welcome to Askimo TV. Today we're with Graham Price, who's a multidisciplinary therapist, a coach and a trainer, and we're going to be asking what therapy is best for me. So Graham, maybe you can talk a little bit about the different options of therapy.
Yeah, sure. There's my goodness, there's a lot of different therapies, but there's probably only three that we would call mainstream. You know, three therapies that are well known across the world and been around for a while and have been well tested and trusted. One of those is probably something we call counselling. It's probably the simplest, needs the least training as far as the therapist is concerned. And most counselling is something that we call person-centered therapy, which is really just a talking therapy. So if you go to a charity or a church who has counselling and offers free counselling, you're probably having this sort of therapy where the client just talks and the counsellor kind of reflects a little bit and feeds back a little bit, and problems are kind of solved just by the client talking. Now, getting more, further up the scale, if you like, of respected therapies, I guess then you get to something called psychodynamic therapy, which is as old as the hills. It really goes back to Freud and what he was doing, and others who have advanced what he did since. And that's it used to be called psychoanalytic, it's now called psychodynamic therapy, sometimes psychodynamic counseling. And that is the sort of therapy that explores childhood issues, deals a lot more with the unconscious, still very much based around talking, but uses the relationship between the therapist and the client a great deal. As I say, that's a very old therapy. Now, a more modern therapy, and the one that's used mostly now around the world, is called cognitive behavioral therapy, and that is a therapy that looks at people's thoughts, or what we call cognitions, and their behaviors, and attempts to change them. So CBT, which is cognitive behavioral therapy for short, is now the most popular and widely used therapy in the world today.
Okay. And maybe you can talk a little bit about the sorts of reasons that I would look for a therapist or a counsellor. Yeah,
therapy is really appropriate when you have some sort of emotional issue going on, or what we call an emotional behavioural issue. So examples of emotional issues would be, well, the most common problems that fall into that category would be something like anxiety or depression. They're very common. People tend to go to GPs initially with those sorts of problems, and the GP will often or normally refer them to a therapist to resolve emotional issues such as anxiety or depression. What we call emotional behavioural issues have got more of a behavioural component. So something like an eating disorder would fall into that category, where there's problems with behaviour, with what people do, as well as their emotions. Emotional behavioural problems are driven by emotional problems, but they are reflected in the way people behave. Either of those sorts of problems, therapy would be the appropriate way to deal with them.
Mm-hmm. And if I feel like I've got something that I'd like to work on, how would I know which is the best sort of therapist for me?
Well, it depends on a few things. I mean, first of all, if you can't afford any sort of private treatment, then you're probably going to end up with either a charity that provides counselling, or you could go to the NHS where they do provide CBT. Though the NHS still has quite long waiting lists, and the people working in the NHS that give you the free CBT are usually either still in training or they're newly trained, so not a lot of experience. That's if you can't afford private treatment. If you can afford private treatment, then you've got a choice then between psychodynamic therapy or CBT. Psychodynamic might be particularly useful if you've got childhood issues that are unresolved and you want to go back and explore them and explore your relationship with your parents, and recognizing it takes quite a long time to do that. So psychodynamic therapy might be appropriate in those sort of situations, but most of the time CBT, cognitive behavioral therapy, would be the best approach, particularly if it's combined with something called an acceptance-based approach. So, because that makes CBT much more powerful. So advisedly, you'd look for a CBT therapist who's experienced and highly qualified, probably BA, BCP accredited. That would be a good way of knowing that they're qualified and experienced. And also combine CBT with an acceptance-based approach, such as acceptance action therapy is a very good one, or acceptance and commitment therapy is one of the earlier acceptance-based approaches.
Okay,
and
Graham.
You'd find those people in the BABCP directory. That's the British Association for Behavioural and Cognitive Psychotherapies, BABCP.
Okay, great. All right, well, thank you very much for being with us today, and thank you very much for sharing your thoughts on what therapy would be best.
It's a pleasure.